This morning, I'm joined by Phil Whitlock from the Sport Clinic. Phil has competed as a professional athlete himself and has kind of turned over his experience in professional sports to his career now, whereby he helps to keep professional athletes at the top of their game. Phil's a sports therapist. His clinic is the Sport Clinic. Phil, can you tell us a little bit more about your background in professional sports and where you are now?
Yeah, sure. So my background is taekwondo and kickboxing. I started training when I was 7. I made the England team at 14 and stayed there until I was 30 years old, winning some English, British, intercontinental, and some world titles. I also kickboxed professionally as well, winning a couple of English titles. Um, I then had to retire a little bit earlier than I was expecting to, and had a hip replacement on my left side, which in the process of doing that, I was very always have been, but also delved into the rehabilitation for my hips. I want to maximise the results from my surgery, and that developed into me taking a career change. I always assumed that I was carry on with martial arts coaching once my athletic career had finished. However, it was the inspiration from my own experiences, having recovered from injuries and major surgeries, that led me to want to be able to do the same with other athletes, in terms of both recovering from injury and preventing injury, and them having to go through the experiences that I did in the first place. And then I set up the sport clinic that I run from Bristol in England. And yeah, we work with a variety of different clients, mostly athletes, amateur through to full-time professionals, and in which we use a lot of class 4 laser treatment very successfully.
Excellent. So note to self, stay on the right side of Phil. So when you're seeing athletes as your primary patient type in your clinic, what types of pathologies are you seeing coming through your door most often?
Lots of muscle strains, tears, tendinopathies, lower back pain. Yeah, mostly musculoskeletal injuries. We've had a few more serious cases in clinic recently. We've actually had a non-athlete come through that was involved in quite a large industrial accident. Had several major bone breaks that we're helping him rehabilitate to. But with the athletes, yeah, we're mostly looking at muscle tears, joint pain, plantar fasciitis, particularly in the basketball players. I'm partnered with the Bristol Flyers, a professional basketball team in our city, and so a lot of knees, ankles, feet, that we treat.
Yeah. And are you talking mostly kind of acute injuries, or do you get, a lot of chronic kind of pathologies like your plantar fasciitis and your tendinopathies as well, a good mix?
Yeah, we get a good blend. I'd say it's probably about 50-50
Okay.
for acute injuries. People will come in, and we will use manual therapy, injury rehabilitation, and we find that using class 4 laser treatment really just maximizes our results, quickens up our recovery time, and we can get people back on the court, back on the pitch, back in the ring much quicker, with a higher success rate, if we combine some class 4 laser therapy in their treatment plans.
Yeah, perfect. So that's kind of answered my next question, which was like, why do you use, so it's an MLS class 4 laser that you've got in your clinic. And with athletes, they want to be back on the court, on the pitch yesterday, please. They want a magic fix. And we can't always give them a magic fix, but laser does give something that allows you to speed up, how quickly they start to feel better and how quickly they actually heal as well. What would you say, this might be a tricky question to answer, but on average, how much faster would you say you find your patients getting better when you're using the laser versus before you use the laser? Is that a question that you're able to answer?
It is, well, so we've had a couple of cases where I've had a quite serious runner that's had some Achilles tendinopathy. He hadn't been able to run for over a year without having any pain. He'd been to, I believe, 2 to 3 different clinics in the area that are very good, very reputable, with fantastic, treatment in their clinics. However, that don't use class 4 laser therapy. We did 5 sessions together where we did normal Achilles tendonitis protocols combined with class 4 laser therapy. And as I said, 5 weeks, he was back. His last session, he came in and said it's the first time in over a year that he's been able to run pain-free. He's ran 4 or 5 times this week. And actually, it was quite an emotional moment for both of us as a clinician and a patient. Being able, I could see how much it meant to him to be able to get back to the sport that he loves. And he said a lot of his running is to do with his mental health. And it was a really special moment knowing that we've been able to provide him using the correct tools, such as the class 4 laser, to be able to help him reach those goals and those targets. With things like muscle tears, muscle strains, just being able to get them in from day dot. So, as soon as that acute injury happens, a lot of people will contact me and say, should I leave it a week? Should I leave? When should I come and see you? And it's very nice to be able to say, come in now, and we can start accelerating that healing process for you straight away. Whereas without that laser therapy, it's we might have to leave it a few days, or here are some icing protocols, etc. But actually, the fact that we can get them in straight away not only accelerates their recovery time and return to play time, but also psychologically is really good for the athlete in terms of knowing that this has happened, but straight away there are actionable protocols that we can take and interventions that we can make that will immediately start decreasing that recovery time for them. Yeah. Is really big help for both clinician and athlete.
Yeah, definitely. I always say laser is not a selfless treatment. It's a feel-good thing. You want to make your patients feel better. That's why healthcare providers do what we do. But when you get that feedback, I totally get what you're saying about it being an emotional moment, because I've had similar myself, and you really do, you feel good for what you've achieved for that patient. It is a game changer for them, especially like you say in patients where their activity is directly linked to their mental health as well. It's all so important. So that was a really good example. So something that I'm often asked about as well is, how do you incorporate laser into your treatment pathway as well? Are you tending, as a more manual therapist, do you tend to use laser as part of your treatments? How often do you see your patients? Do you ever use laser as a standalone? How do you work that?
Yeah, so we have the options in the sport clinic for both. So we do offer the service of just laser treatment for things like arthritis and other sort of more chronic things where manual therapy has limited use. It's really great to be able to have that as a tool to treat people's pain, where actually hands-on treatment probably would have limited success. And then with injuries, the fantastic thing about the treatment is that it doesn't take that long to administer. So the fact that we can, in a normal hour session, people can come in and we can spend 5-10 minutes reducing any swelling, reducing any pain, particularly before then going on to, if we do administer some manual therapy as well. Just that combination of both, I just find makes the client feel better. We get better results and reduce that return to play time for them.
Yeah, Brilliant, Phil. That's excellent. I think that's a good argument for the use of laser as part of your treatment plan when you're dealing with athletes. So thanks so much for your time. I know that you're super busy, and I really appreciate you giving some of it up to talk to me this morning.
My pleasure, Kirsten. I just want to say is if you are considering looking into Class 4 laser, do the research. All of the scientific research is there. It's valid. It works. And from a personal point of view, it's made a humongous difference to my clinical work. And it's something that pops me over and above some of the other clinics in the area. So I work with a lot of American basketball players. So Class 4 laser treatment I find in the UK, some people haven't heard of it, and you sort of have to explain it to them. All of the professional basketball players that have played NCAA Division I basketball in the US, as soon as I mention to them, all of them say, "Oh yeah, we have that all the time in the US." Like, yeah, please let's go for it. So it is being used on the international sporting stage, and it will be a great asset to your clinic to be able to offer something that is being widely used in professional sport for your athletes and for your non-athletic clients as well that are looking to reduce pain and decrease that recovery time and just get back to doing whatever it is they love, whether that's sport or playing with their grandchildren.
Yeah. I didn't pay him to say that, honestly. So thanks so much, Phil. Like, I don't think I could have asked you for a better testimonial than that. So that is brilliant. Thank you very, very much.
My pleasure.